Hey there, this is Dr. Blair Reich. I'm going to report to you on a pretty odd series of things that, here's another rabbit hole that I just went down, and it's pretty bizarre. So we're at my Steemit blog, which is at Agrod. Okay, so we're going to start down here. So Clinton collapses at the 9/11 service. So hopefully everybody's seen this video by now of Clinton had to get escorted out of there. And you can see that same guy. I don't know if that's him in this picture, but, you know, the same guy that's been falling around that was presumed to have that diazepam pen, he's there. He was on the plane with her recently. He was there carrying her up those stairs. And, you know, we've seen a couple weird things out of her. There were some lesions on her tongue. There was people thought that she had a seizure and the eyes aren't tracking. So it's not just like she was being goofy, but the eyes weren't tracking. There's that diazepam. Maybe it was just a pen or a flashlight, as some say. But if you look at the badge that he's wearing, he's probably not standard Secret Service. Secret Service all know one another, so you don't actually need to have a badge. So the fact that he's wearing that badge says that he's not your standard Secret Service guard, and in fact has special clearance and wears a badge to show off who he is. There were some leaked medical records, and she's pretty adamant that these are lies and fakes. And look, there's no official letterhead on them, but there's at least this where it says that she's suffering from vascular dementia and has some seizures. So there's some medical records that are of concern. The same guy was there for Bill Clinton's. This is his heart bypass or something, I believe. So you could watch this. So that's just some things to note. So the very first piece of this was just that she got carted off. And so the next piece of this is that because she got carted off, the DNC, the CNN announced that she's been diagnosed with pneumonia, which is odd because you can see her hanging out with this kid. Pneumonia is pretty infectious. Why would she be standing right next to a child? So something doesn't match up between the photo op and the diagnosis of that. But David Schuster, who is like an Emmy award-winning journalist, came out and said, hey, look, what's his actual tweet? His actual tweet's down here somewhere. Clarification from the Dem operatives at Hillary Clinton, pneumonia, expect emergency DNC meeting to consider replacement. So he came out almost immediately thereafter, like right after that thing happened. I guess that's 10 o'clock on September 11th. So this thing is barely 12 hours old, and said that she's going to be replaced. Okay, so that's sort of fascinating. Then the next thing is that sort of looking at all this pneumonia things, I dive into this, and pneumonia, I think, is just one of multiple symptoms here. So they start by saying, oh, she's just overheated and dehydrated. Then she stumbles, and it's pretty bad. She goes full on limp here. Let's see. So that's the guy that I was talking about earlier. I guess that is him. But they help her in. Look, her foot just like totally goes limp. They're like dragging her in there. That is not just a simple, overheating or something. So, the campaign has like officially announced that she has pneumonia, but pneumonia doesn't like account for why she has coughing fits. That's what this video is. Why she has seizures, and pneumonia wouldn't account for that. Why she has these like crazy looks and seems to just sort of like totally drop, normal thought process, or why she has lesions that seem to have been removed from her tongue. And also, why is here's a doctor that's with her on 9/11. That's a pretty standard neurological thing to do if you're worried that your patient might have some of these neurological symptoms. One of the things that they force you to do is to like, can you squeeze my finger? Are you able to respond? Additionally, sort of these blue lenses, no matter how cool you might think they are, they're they're alleged to be these Zeiss Z1 blue lenses, which are actually anti-seizure lenses. I guess they're blocking some kind of light that allows for that to sort of decrease the amount of seizures. And so CNN comes out and says, look, anybody that's investigating her health issues is a new birther. And that's unfortunate. That's going to set off a lot of people. But so, if we start looking at her health record going back, the Seth Rich, who probably was the one he was killed, but he's allegedly murdered. He was the guy that gave Julian Assange the email server info that WikiLeaks published. One of those contained an email by Huma Abedin, who's one of Clinton's closest aides, that said she's currently suffering from a life-threatening right transverse sinus thrombosis, and that was part of this concussion thing that she suffered back in 2012. That led to this anticoagulation therapy, and they talk about, she's just suffering from gastroenteritis, which is the stomach flu. But here are some of those symptoms of the thrombosis that they talk about: impaired speech, difficulty moving parts of the body, problems with vision, headache, increased fluid pressure inside the skull, pressure on the nerves, brain injury, developmental delay, and possibly even death, which comes into play if you're trying to be a presidential nominee or the president of the United States. Anyway, there's this doctor that came out and said, look, I've been working with Parkinson's patients forever, and a lot of what we're seeing here is actually Parkinson's-related symptoms, that he thinks she has Parkinson's. And so that comes from Huma's statement of she's often confused. She demonstrates classic Parkinson's disease hand posturing. She holds her hands close up to her chest when she's holding a microphone, and it's meant to keep her from shaking. During some of her interviews, she had bizarre head bobbing. She just kept nodding her head. And it was, you do that a couple times and it starts looking like, you're just nodding in agreement. I think they counted it over 500 times during the interview, and that starts looking more like Parkinson's sort of involuntary head movement. You get some of these bizarre wide-eyed and mouth opened stares in that ballroom drop, and that might be some of this possibly dementia. Part of that might be the Parkinson's. Her eyes aren't moving in the same direction. And then there was that one campaign speech where there were protesters and suddenly she just completely froze. So you have sort of these symptoms of pneumonia, you have dementia, you have Parkinson's, you have lesions on the skin. And unless she has 3 separate illnesses, which is entirely possible, I'm not ruling that out, but one thing that could actually account for all of these is syphilic aseptic meningitis, or she has syphilis, and it's happened in a couple stages. So here's one of the lesions. This is just some Google image search that I did. You get lesions on your tongue. But if it's syphilis, it could actually explain why she's coughing, fainting, the seizures, dementia, brief personality changes, incontinence, and we can talk about that in a second here. There's some evidence that she's actually suffering from incontinence, and that she has a catheter, and that's the reason why she's always wearing these pantsuits, is that there's medical devices that might be tucked up into her leg. As you can see sort of there, the line, that's not just like a pant crease, but that's actually like a medical line that's sitting right there. And you can see it sort of the bulge of one of these bags in case she has an accident, because that again would be explained by the syphilis. So syphilis kind of starts with headache, confusion, maybe a couple convulsions, but it also starts with some flu-like symptoms, and then it takes a couple years. So if she had that stomach flu a couple years ago, maybe that was actually the start of when she had syphilis, and then the syphilis is actually getting worse. And so as it spreads into your brain, you get personality changes, strokes, visual impairment, bladder incontinence, seizures, headaches, and then there's even more that start going into here, some of the mania, and which might explain some of the weird outbreaks of why she's saying that all of Trump supporters, I forget the exact words, but they're all not deluded, deranged, or but it was a negative D word. Anyways, so here we go. there's a couple case studies that I put into this that maybe Parkinson's Parkinson's is like a symptom of having neurosyphilis. Here's another one. This is a quote from the paper. Parkinsonism is like when you exhibit the behaviors of Parkinson's disease without necessarily having it. Has been presumed to be the consequence of syphilitic involvement. So there's another paper that's linking that. Here's an article that talks about the steps of diagnosing Parkinson's disease, and it includes the step of checking for tertiary syphilis to rule that out as a cause. So you could link, I guess I don't have it up there, but the tongue lesions, the cold and flu symptoms, the dementia, the Parkinson's-like behavior, and sort of like the moments of freezing, and all of that can all be tied into tertiary syphilis, and that could be a explanation. And I also put in this meme of just making sure everybody knows that I'm not trying to die anytime soon. Sometimes people that have negative things to say about the Clintons do. And then lastly, it keeps going. There's been sort of an explosion of all these people that think there's a body double. So she falls, she goes to the apartment. This guy's amazing. Martin Shkreli, the guy that hyped the AIDS drug, was like standing out there harassing her and shouting at her. And then afterwards she comes back. And so, just a quick look, she looks younger and she looks thinner, quite substantially. And so here she is again. And this is the most striking one to me. I guess that's why I put this first. But that nose, man, that does not look like Hillary Clinton's nose. It looks like somebody kind of pressed her nose up against her face and smushed it, and it stayed that way forever. And she's just also very thin. So there is this professional Clinton impersonator. Her name is Teresa Barnwell. So some people think that it's her. To me, her nose doesn't look right, but she didn't help anything because she actually tweeted this picture. Maybe I was in NYC today, and this is on September 11th. But then she took it down. And so, the people that mainstream calls conspiracy theorists say, look, here's this woman. She's claiming to be in New York. What she posts is 1 block away from where Chelsea Clinton's apartment was on 9/11. And then out comes this beaming, 10 years younger, 50 pounds lighter, Hillary Clinton coming out. So there's some concerns that maybe that's her. And then you have sort of these other facial structure things where like the hair is different. It's flat and it has no body. Position of the scalp, where it is on the scalp, it looks like her hairline is a little bit recessed compared to where this version of Hillary's is. She's thinner. Her neck is smoother. Some of the nostril lines are different. And then here's just a bunch of trending pictures that are on they're on Twitter under Hillary's body double. And I just pulled out some of these. But again, it looks like there's a little bump in the nose, and there's no bump in the nose here. I can't tell. Other people seem to really believe in this one, but the hair's in the way. So it's kind of tough to tell what the rest of that would have done. I mean, this looks normal. Maybe that's the same. I can't quite tell from that one. And the same thing here. That looks like a pretty straight nose, and this looks like a pretty big bend in the nose. The smile looks different. The chin looks different, but maybe it's just the angles. Coming down here, these look like two different people. Actually, it kind of looks like the same person, but just, 10 years apart. This person is thinner, has fewer wrinkles, has some different creases, doesn't have sort of like these little marks. I don't know what those are called, but these kind of extra creases down here. This is almost sort of like a little bit of a Joker's smile down here coming out to the left, and none of that's present over here. So that looks suspicious. And so here, this is what she looks like before she went in. And maybe it's just the sun, but I'm not sure that the sun can sort of take off that many years all at once. Some people note that it's a difference in weight too. Her belly protrudes just a little bit over there and not so much over there. The finger length is different. It's hard because these things are not scaled perfectly to size. The hands look relatively similar, but there does seem to be a small difference between the first and third finger here and the first and third finger, that these two are basically at the same height, whereas these two are not, indicating that it might be a different hand. And then this person, you know, when you're getting a closer look and it's just up front, she looks too young. She looks thinner. I mean, she looks a lot like Clinton, but that person doesn't look like Clinton to me. Anyways, you know, this is just funny. Washington Post, can we please stop talking about Hillary Clinton's health now? And now it's Hillary Clinton's health just became a real issue. So within a week. So from my perspective right now, you know, can we please stop talking about the body double? It's some crazy conspiracy theory, but man, when you look at those pictures, it's kind of tough to believe that it's the same person. So anyways, that's a lot to sort of consider, that she had some sort of serious health problem, that she got taken away, and that the serious health problem is probably not simple pneumonia. It's probably something closer to either a combination of dementia, Parkinson's, and pneumonia, or it can all be explained under one umbrella of tertiary syphilis. Then she goes into the Chelsea Clinton's apartment, comes out, and she's much younger, healthier, skinnier, and so people think there's a body double. So I know this was a fairly long video, but man, a lot happened at a very short period of time, and this is the best I can do to try to figure that out. Thanks, guys.